Yes. Try to teach them, starting from the anatomy.
Yeah.
How can you going to tell someone is
Without
every-
telling them about the anatomy.
What are they going to tell?
Yeah.
Anatomy and physiology.
Yeah, the
Starting
anatomy
from
and
that.
physiology. Yeah.
Tell them.
Okay, so from the anatomy of the body,
Yes.
we are going to tell them, firstly, with sexual relations, once you intercourse with any sexual person and have sexual relations, what are the consequences that are going to come? The release of hormones, what incorporates after that, what comes back, what comes out after all those relations that they have. And we are going to ask them, is it really necessary for them to have a sexual relation right now? So we should teach them about the different changes of their body.
Okay.
Let's say once you have sexual relations, you're going to encounter probably pregnancy or not. You can, even during pregnancy, you can encounter abortion.
Yes.
Teach them about how the body is going to change.
Yes.
Teach them about how even after pregnancy, what are you supposed as a mother to give? Yeah.
So we are going to start by saying the anatomy.
Yeah.
You have the head, the chest, and the leg. And also you're going to say about the genital organ, how it functions. If you are a girl, the puberty stage, the change in the body, the menstruations, for the boy to know how the erection, even the ejaculation, to don't surprise them. I think that when we give those kind of information and we are given it by the right people, they're going to give you the right information.
Yeah.
So suppose that you are, and not suppose, you say that you are a medical student and you are a doctor in the future, and you encounter people with disabilities, suppose who is not seeing, and he's come to you to help him about his sexual desire. What can you go to tell him?
About his sexual desire. So firstly, we should give them options with either to use contraceptive use or not using contraception. That is according to what he wants, the outcome of their sexual relations that he's going to do. So, and secondly, we are going to, you first assess the knowledge that he currently has right now.
Okay.
Then you can thereafter know what to add and what not to add.
Okay.
Yeah. But they're supposed to know all the different topics that are available, the different points that are available in sexual health that will help them to avoid any consequences that may come unplanned or any consequences that they didn't know ahead. So it's to give them the right information at the right time.
Sometimes the people, they think that it is not right for people with disabilities to have sex.
Yeah, that is actually a taboo, which is the whole point that most people don't give sexual health education to people living with disabilities.
Okay.
Yeah. So there are certain people who have siblings living with disabilities, and they also have siblings that are actually okay. So you find parents mostly talking about that topic to the kids that are okay, leaving out the people with disability, with the mentality of thinking that they are somehow more asexual, or they don't have the same desires as the other people do, they don't have the same feelings. But every person, with people living with disabilities included, has a right, and they also have the same desires that normal people do.
Okay. Is there any myth or misconception or barrier that exists around the sexual health education for the people with disability, and how we can address that?
So the barrier and myth around people living with sexual health education, firstly, is the one that you have mentioned earlier, which is asexuality. Most people think that they don't have the they don't have the desire to have the sexual desires. Yeah, they do. They are also like other people. They're also like other people. And also, another myth is that people living with disabilities won't be able to give birth. So most people think that they won't be able to get pregnant, which is also why they're most vulnerable to abuse and exploitation. So which is also actually not true.
Okay.
They are also like normal people with the same hormones, the same body physiology, and the same changes that can happen.
Okay.
So another thing is that people have a taboo thinking that once we teach these people living with disabilities about sexual health education, it's like a ticket free to have sex, which is actually not right. So we are also trying to warn them like the other people. Yeah.
Okay.
We are trying to make them know the right health education. We are trying to make them know that they have the same rights, they have the same desires, they have to make the same decisions like other people.
Oh, wow. So it means that the people with disabilities are like a normal person.
Yeah, it's a normal person.
They can have some kind of limitation, but they are normal like other people. Sandrine, how can we promote autonomy, self-determination, and empowerment in sexual health education, mostly for the individual with the disability?
Yeah. So to mostly help with the autonomy and self-determination with people living with disabilities, firstly, I think we can have interactive sessions.
Okay.
That is interactive sessions between people living with disabilities and those people without disabilities.
Yes.
We can also have peer support groups among each other.
Okay.
Like let all people living with disabilities, they come, let them talk about their challenges, talk about how they can fight the challenges that they're facing. Let them talk about which kind of advocacy that they can be able to do for themselves, which kind of advocacy that we can help them with. And aside from that, people living with disabilities, except interactive sessions and peer learning groups, also let healthcare providers reach out to them with a respectful manner. Let them talk to them in a respectful way, and also again in the same formats that are easier for them to understand and learn. Yeah.
Wow. So let them be there.
Let them
decide themselves.
Yeah, let them have their own decisions.
And they know the boundaries of their body.
Yeah.
The limitation. And
how to give consent.
Yes.
How they should say no or yes. Let them know where the boundaries of their body stops from and where it should begin from. Let them have every right that they should have to own their own body and their life.
Yes, and they know the right things. It is the right to have sex, it is the right to have a partnership, it is the right to have a marriage, and to know the whole thing about the sexual education. The last two questions is about what is resources where they can find those kind of sexual health education, mostly for the people with disability. And also you are going to go with the technology of today, what the role of technology can help to enhancing those access to sexual health education, mostly for people of disability.
Okay. So on your first question, so the current resources right now, the government has been releasing and also is still helping to be able to incorporate the sexual health education in the curriculum.
Okay.
So I believe the sexual health education, particularly with people living with disabilities, should be incorporated in the school curriculum. And we should also give them a chance to actually learn and understand. So other resources, different resources on the internet have been providing the same sexual health education with Joe Care included, which has been helping to teach with the hands-on practice sessions to people living with disabilities, all kinds of diverse people. Yeah. So technology now has been playing a big part in helping to be able to access information at different times with different number of people in different communities. So it has been a change maker actually, which is mostly the right decision that has been made right now so far.
I think on technology also Joe Care were included. For someone who is going to watch this, is going to get a lot of information about sexual health education. So the last question is, what is advice would you give or offer to parents, firstly, educator, and healthcare provider who are working to improve sexual health education, mostly for people with disability?
So while concluding this whole talk, I believe let's give the right to these people living with disabilities, a right to choose and a right to their own body and a right to their own life. So they're able to do so much more than we actually understand. They're able to learn like other people do. They might not be on the same level like other people, but we should be able to be there for them. We should be able to teach them. We should be able to answer their questions, and we should not be able to exclude them at all times. So they mostly face different stigma and discrimination in their communities, in their friends. So as healthcare providers, as their supporters, and as their caregivers, let's not do the same. Actually, let's incorporate them back in the community. Let's teach them the right education, and let's all be the change makers that we need.
Thank you, Sandrine. By giving this good advice to everyone who is with people with disability. I think it is a good thing to know that people with disability is a normal person like everyone,
like other people.
And his or she have the right to know everything about sexual health education. So 3 key summary for someone who is watching us, who is going to retain in this whole discussion.
Okay.
3 things.
3 things. Firstly, people living with disabilities are like other people.
Yes.
Secondly, they have a right to choose and who to choose. They have a right to their own body.
Yes.
Thirdly, as change makers in our community, let's also have a burden to teach each and everyone without discriminating or having stigma against any other person according to how they are, according to how they were born, or according to all the diverse needs that they have in their lives.
So thank you, Sandrine. We have a good discussion, and I think everyone who is watching us is going to know many things about how we can bring a gap, mostly for the people with disability, to know more about sexual health education. It is good to know that people with disability are normal people, and it is good not to know that the sex is also a basic need. Everyone should know that he needs that or she needs that, and to know the right thing to do with that. So I can say that if you have any question or if you like this topic, you can go down there. You like this, you like our discussion, you write a comment by asking the question, and also you share with your friend. So we love you, we are loving you in Joke here. I'm called Shaddai.
Thank you very much.
Ciao, ciao.